It's Dr. Davis with Active Health Knee and Shoulder, and I am here with my office manager, Becky, and we're here with one of our patients, Betty. And Betty and Becky have two things in common. They're both on the Trust Your Gut program. So I know there's many people out there, they're contacting your office that are having gastrointestinal issues and they don't know what to do about it. You know, they're throwing a bunch of medication which just covers up the symptom. It never really gets to the cause of the problem. So I wanted them to just basically tell about their experiences, some of the problems that they had before they started the Trust Your Gut program, and then their experience as they kind of went through the phases 1, 2, and 3, and just where they're at right now.
I was suffering from IBS, and I spent a lot of time in the restroom. And now, within the first week, my whole life has changed. The bathroom isn't an issue anymore. I'm able to sleep better. I've lost weight. And I feel fantastic. Well, how about you, Betty? What have you noticed?
The same things. I just feel better. I've lost some weight, and it's just the best thing I've ever been on.
And one of the things is we found what foods do not agree with our body.
Yes.
I have definitely, dairy is not my friend. Dairy is not my friend. So with the program, you have foods that you have to eliminate, which we did eliminate, and then after the 21st day, you start to bring foods back in. Some of the foods that I brought back in, you have an immediate reaction as to if your body likes it or not by your heart rate. If your heart rate fluctuates up or down, that is not a good food for you. So then you wait another 30 days and then try to reintroduce it back into your daily foods that you're eating. Definitely dairy is not my friend, and there was a couple things.
I could have sour cream and Philadelphia cream cheese. Those two things in dairy so far.
But like with my dairy, sour cream is definitely out of the question. But I'm able to have like feta cheese, the dry crumbly cheeses. For some reason, I'm able to, my body can tolerate that. The other cheeses, there's no way. No way. Creams, milk, just is not good for me at all. So I've just learned other things to substitute it. You know, instead of milk, I'll have almond milk or whatever, you know, to do replacement. So I encourage anyone out there, if you are having stomach issues, to get in here and try this program. It is a life changer.
It is lifesaver. Lifesaver.
So that's basically it. It's one thing hearing it from the doctor saying how great our program is here, but you have two ladies that have had similar type of gastrointestinal problems, and their lives are literally transformed. And I know there's the people out there that don't think they have a solution and just have to kind of maintain their condition. That's not the case. You can fix this stuff. It takes some coaching, because many people have tried all kinds of fad diets in the past and they just don't work. This is very thought out. There's 3 phases. It's easy to follow. So there's proof right here that this works. So we encourage you to contact our office. You can talk to Becky personally if you needed to, and we just go bring you through a process. We do a survey and evaluation, see if you're a good fit. So God bless, and we look forward to hearing from you. Have a good day.